The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. There's no substitute for an in-person appointment, but we hope this comes close. I'm your host, Eva Shea, and you're listening to Meet the Doctor. Welcome back to Meet the Doctor. Today, my guest is Dr. Jacob Sedgh, and he's a plastic surgeon in West Hollywood, Beverly Hills, Los Angeles, California, and I'm so pleased to introduce you. Welcome, Dr. Sedgh. Will you tell us about yourself?
Hey, well, thank you. Yes, I am a facial plastic surgeon in all those areas that you mentioned in LA.
Those of us that are not in LA, it's all LA, right?
But I think, right, no, exactly. No, it's funny because we are right at the border of West Hollywood and Beverly Hills.
When you describe it to people in Los Angeles, what do you tell them?
Randomly, sometimes, exactly as you said, sometimes Los Angeles, sometimes West Hollywood, sometimes Beverly Hills.
Is there a big landmark near you? Like, we're right by the...
There are a lot of landmarks here that people know, but we are on Sunset Plaza, so that's already a tourist attraction. And there are a couple of restaurants across the street. Is Boa's Steakhouse, that's kind of popular. Mm-hmm. And underneath our building is Lava Restaurant, which is fairly new in LA, and that's popular. So those are two of the landmarks.
Do they have a valet so you can just use the valet and pretend you're going to eat when you're really just going to work?
When I'm running late, yeah. You can try.
Well, I didn't intend to go in that direction so quickly.
No. But it's pretty much the same price as the valet here in the building.
Yeah. Those are the perks of the building.
You know, even when my mom wants to come here, she's like, yeah, your valet is so expensive. And then if I dare come for just Botox, I'm like, yeah, this building, their first couple, even for 2 hours, they almost charge you full day.
Oh, wow. Well, you should work out a deal with them, don't you think?
I don't know. One of my managers tried, but I stay out of that. Yeah.
So we went on a tangent already. So let's get back to the topic, which is you. You're a facial plastic surgeon, and I apologize for saying just plastic surgeon because there's a big difference. Tell us what is facial plastic surgery and how you ended up in that specialty.
Sure. So that's a good question. Interesting. My last consult today, she asked me the same question. The difference between plastic surgery and facial plastic surgery. So there are two ways you can become a plastic surgeon operating on face. One is going through the route of general surgery on a preliminary note and then focusing on plastic surgery. That is more becoming like a general plastic surgeon, but a lot of times people don't like to use the term general plastic surgeon. They're like, it's just plastic surgeon. So, but those are the people who do the whole body. And we live in an age and era that a lot of things are more and more subspecialized. So naturally, a lot of those surgeons, they will focus on particular areas. It's rare, at least in Los Angeles, to find someone who does every part of the body, like face, nose, eyelids, and breast and body. It's very rare. So that's the one route. Then there are two other routes to operate on the face. One is becoming a facial plastic surgeon, which is going through a head and neck surgery residency. So since the beginning of the residency, we focused only operating on the face and neck. And then at the end of residency, we got to decide what kind of niche we want to go into. And facial plastics and reconstructive surgery is one of those. And that's what I chose. So that way I operate on only face and neck when it comes to plastics and reconstructive types of surgery. Before I was doing more reconstructive cases. Over the last couple of years, it's become more and more cosmetic. And then there's a last route to do oculoplastics, and that is people who go into ophthalmology residency, and then they want to subspecialize on the eyelid surgery, but they only do eyelids.
How does reconstructive surgery on the face influence how you would approach an aesthetic surgery?
It does. Yeah, it gives you a experience with the reconstructive surgery. It gives you an edge, in my opinion, as far as understanding scar formation, contraction. What are the things that you got to be careful or worried about more than just someone without that background in reconstructive surgery? So to me, yeah, my rhinoplasty experience has benefited from learning from those type of surgeries.
So, did you do things in the past like help people whose noses were broken in accidents or
All
trauma?
types. There are photos. The photo of one case on my website, this lady had a basal cell cancer on her nose that, basal cell is a very slow growing type of cancer. It almost never kills you because it's the most slow growing cancer in the head and neck area, but it can be locally destructive. So she kind of ignored it. She thought it was an ulcer. It wasn't diagnosed early. By the time she was referred to me, she had lost her nasal tip, most of her nostrils, and about a third of her nasal septum. So it was almost like having a chunk of her tip and surrounding portions of the nose cut off. So yeah, I had to do 3 surgeries, 2-stage surgery with a touch-up surgery to reconstruct her nose.
And does it just look like her old nose now?
It will never look exactly like the old nose, but it was a decent looking nose. The picture is actually on my website and the reconstructive part of it. It's one of my favorite cases because I know one of the surgeons who saw it, he was like, I think you should just tell her to go for prosthetics. And I was like, I think it can be done. It's going to be a lot of work. So
I will find that case and I will link it in the show notes. So if anybody's listening that wants to look at it, we'll make that easy to find.
Sure. And actually at the end, she said her breathing was improved compared to prior to surgery. So that was good.
So you've done trauma, you've done reconstruction, you do cosmetic noses. What about secondary or beyond? Do you fix other rhinoplasties that have not gone well in other places?
Oh, yeah. That's revision rhinoplasty, which is about a third of my cases. Yeah. Revision rhinoplasty is my favorite type of surgery.
How are they finding you for that?
There are different routes. Some is word of mouth. Some is, there's more and more online these days. A lot of them, they find us through our reviews of different platforms. Some find us through Real Self. Some find us through social media.
Are there a lot of noses to look at on your social media?
Yeah. Yeah, we do post quite a bit.
I think they're some of the most fun cases to look at because the impact is always so, people's whole face changes from a tiny change to their nose.
Well, nose is the second most important aesthetic feature of the face. Do you know which one is first?
Eyes, probably.
Exactly. It's eyes. But there's a caveat. So eyes are the most important. But eyes, for the most part, because of their positive aesthetic value to the face are significant. Nose has a more of a negative aesthetic significance. So nose is mostly distractor of the beauty. It's not the notion of beauty. So beauty icons of the world, let's say Marilyn Monroe, when I bring her name up and then you start thinking and visualizing her, you remember exactly what her eyes look like. But you probably don't remember exactly what her nose looks like because nose is mostly a distractor of the beauty. So my job as a rhinoplasty surgeon is to bring balance with the rest of the face and focus on the distractive features of the nose and take them away. So I tell people, usually a good rhinoplasty is when you look at someone, you don't pay that much attention to their nose. So that's why it's very important for the results to look natural, because natural is seamless. You just look at the natural thing and you're not remembering it. You're not particularly paying attention to it. Then your focus is on the prominent positive features of beauty, such as the bony anatomy, eyes, lips.
Now, if I reverse it, and I'm trying to think of a celebrity with a signature nose that everyone would remember, and I'm just struggling to come up with one. Can you think of somebody?
Signature nose meaning like a very good looking from an aesthetic standpoint.
Well, memorable. Maybe
Memorable.
not necessarily good looking.
Well, if it's a good looking nose, it's probably not memorable.
Here's one. Am I the only one who remembers Lady Gaga's original nose? She definitely had it changed at some point. So there's one. And I remembered it because it was noticeable and now it's not. And if she had not been famous before she changed it, no one would have ever thought of that.
No one probably. That's true.
Yeah. So, but sometimes I think celebrities in particular, they change their nose and then they don't look like the same person anymore.
Well, it's because it's the second most important aesthetic feature of the nose. So it's a big deal when nose changes.
Yeah.
That's why it's never a decision to be taken lightly, because it is a big deal. It's the center of the face. So yeah, once you're in the public eyes, then because you can't really change your eyes that much. There are certain modifications you can do. You cannot do a major change. You can do color lenses and that type of thing, but a lot of, not a drastic change, but nose, you can have a significant modification on it, and that will really change character of the face.
So your nose is right on the front of your face. And if you do not like your nose, there's a very emotional aspect to making this decision to go get rhinoplasty and have it changed. Does that emotional aspect kind of carry forward through and persist after someone has rhinoplasty? And how do you help them go through that?
That's a very good question. The emotional aspect of it is very important. And as a surgeon, for you to be able to relate and try to understand what that feeling is and what are the goals and what are the expectations, it's very important. The noses will never be perfect. I always tell patients what the patient is bothered by the nose is important for me to understand if it's a realistic and anatomically understandable issue that should be improved and how we can improve it. So there's a lot going on, a lot of personal things. Sometimes we have a patient, for example, somebody comes with a large dorsal hump and they want it removed, but at the same time, they still want to keep part of it because that's something that the patient says, I kind of, that's exactly like my dad's hump. I relate to that. I want to keep it. It's a part of my family trait. It's part of my ethnicity. Or somebody comes in and they have almost the same size hump. They're like, I absolutely hate this hump. Every time I look in the mirror, that's the first thing I see. I want it gone. So again, same nose. You got to see what is that personal experience. So you're not going to treat those two noses the same way. And both of them are candidates for rhinoplasty.
Do you have a way of identifying whether somebody is coming to you with realistic expectations for what can be done?
To some degree. That's what we spend, my rhinoplasty consultation sometimes can get into 1 hour. Because I always have the patient. Once we get the general and basic medical history down, we want to focus on the nose. I always start by saying, what are the features of the nose that you like and you do want to maintain? And what are the features that you don't like? That's why you're here. And then that's how we get started to see. And a lot of times people, again, and they have a mirror and then they kind of like, show me the areas, the concerns. Majority of rhinoplasty patients, they do have a decent idea of what's actually bothering them. There are usually 2 or 3 items on the list that they're like, this is the main thing that I want to change. Or this part I actually really like. I really like my tip. I don't want it to be changed. So most of the times, then you can get a good understanding of where they're coming from. And majority of times, I would say majority of the patients, what they convey, it's anatomically understandable. And a lot of times it's something that's not in the ideal, based on ideal aesthetics of the nose, whether it's male or female, and it can be improved. But occasionally there's someone who actually is within the pretty much standard range of aesthetic ideals, and they might still want to change it. And that's when it becomes tricky.
What other kinds of procedures do you combine with rhinoplasty?
Probably the most common one is chin augmentation. On the side profile, there's a very close relationship between chin projection and nose as far as complementing each other or magnifying the effect of one being less or more projected. So the two should always be analyzed in the case of rhinoplasty if there is particular issues with projection. And a lot of times I bring up, if there is an issue and I think there could be an improvement, I just bring it up. But again, it's not my role to tell people that they need a surgery. But since they are, let's say somebody is particularly having issues with projection, then I bring up the idea and I do the 3D simulation for them. So when we do the 3D, I kind of like show them, okay, this is what I mean. So that's something to be considered, because if that is really what's bothering you, and if that's the goal, a lot of times you can see the difference when you see the simulation with both chin modification and nose at the same time versus just doing the nose. And then they can decide.
I'm curious about the simulation. Will you tell me more about how that works and what that process looks like?
Sure. So it's an integral part of our rhinoplasty consultation to do the 3D simulation. And basically it's a specialized camera that we do 3 different views of the nose, and then it will create a 3D reconstruct of the whole face, particularly focused on the nose on high resolution. It's pretty accurate. It has a couple of small inaccuracies that I explain to patients when we do their rendering. And then based on what already patient has voiced as far as what their goals are, then we start again doing it together, basically. I'll do the changes while we're talking, and it's very interactive.
Is it just like a machine that you put a picture in and it spits a picture out, or can you actually adjust?
No, it's adjustable. So it's interactive. And I tell people this is a communication tool. This is not really, I always joke about it. I'm like, I'm not buying this nose off of eBay or Amazon. I'm bringing it to the operating room. This is just it's a mental map. It helps me to plan my surgery in more details. And at the same time, it helps us to communicate better, to see what the goal is. Sometimes somebody thinks they want a more accentuated tip break. And then when we're doing it, they're like, that's too much of a break. I want actually less of a break. And we do less of a break. And they're like, I even want maybe minimal to no break. Or vice versa. They think they don't want that aggressive of a break. And sometimes they're like, so and so. And then they bring some photos and we're like, these are actually more accentuated tip breaks that you like. And then we do that modification. And they're like, yeah, actually, that's what I'm thinking, or I was thinking. So it really helps to visualize, to see what the patient identifies with. The other aspect is, again, the concept of projection and rotation. Projection is the distance of the tip from the face. Rotation is the angle as far as being up or down with relationship to a horizontal plane. And there is no set number for that anybody should follow. We have some ranges for male and female noses, but again, based on across ethnicities, across a lot of variations, it's different. So that is something that is really helpful when we do some changes on the software. People are like, okay, this is the ideal nose that I would identify with.
And then do they get to take the animation with them, or?
We email them. So we do from one side. We just pick one side and then we send them the photos. And again, we tell them the surgery is never going to be exactly like this. This is, again, if we get 70, 80% close to that, as long as the results look natural, and as long as we are getting a solid improvement in those areas of concerns. And that's the point that I convey. That's the point of doing the 3D simulation. And in fact, if somebody gets very obsessive with the 3D simulation, I tell them that might be a sign that you're not a good candidate for rhinoplasty. And I've had patients who actually, I've talked to them and we've decided to hold off. Maybe it's not the right time, because the rhinoplasty is not about particular results. Rhinoplasty is a long journey for a solid improvement.
Speaking of long journeys, I understand, and I don't think that I ever recognized this earlier. I've been writing content about procedures for almost 20 years that it takes about a year for a nose to recover from a rhinoplasty.
Right. To settle, to totally settle, to get the final result. So when it comes to the recovery, I divide it for patients to make it more simple. I divide into two phases. I tell the first phase is the inflammation. That's easier to understand because everybody knows what inflammation is. So I tell them, like, when you have trauma or any other type of surgery or laceration repair, then there's inflammation. And inflammation for about 1 week gets pretty bad. Everything is swollen and bruised and big. And after 1 week, particularly rhinoplasty, we're going to remove the cast and tapes. If we have put internal splints, we're going to remove them. You're going to feel a lot better. And in the second week, you're going to have a lot less pain and bruising, but you're still not socially as presentable as you would wish to be. So you still see some puffiness, you still see some discoloration under the eyelids. So it takes the second week for that inflammation to be pretty much gone. So it takes 2 weeks, and I usually tell people for you to be comfortable to go to dinner. That's the inflammatory phase. So by being socially presentable or being okay to go to dinner, that doesn't mean your nose has fully recovered. You're just at the point that people aren't staring at you. You're not eye-catching because you just have a little bit of a puffier nose right now. So that's the phase that's pretty easy to understand for everyone. The second one is something that's more particular to rhinoplasty, and that's a scar remodeling and contraction. And that's a slow process because it's not inflammation anymore. It's contraction. So I explain to people, inflammation goes down fast. It goes on down in a few weeks. Contraction is a different process. It doesn't go down quickly. Sometimes we need to use the scar modulators to help with the contraction process. So that is a process of over months, and different skin texture and thicknesses, they might contract at different rates. But a good rule of thumb is 1 year. In the first 6 months, you get most of the contraction done. And in the second part of the year, particularly around the tip area, there are still changes towards more finesse. Sometimes I use the analogy of wine getting more refined with time. That kind of like sets it a little bit better because then you know you cannot rush it. It's just a refinement process.
Has it ever bothered you that it takes a year for you to see your final results?
Sometimes, yeah, you're more excited. You're like, I want to see that contraction better because, yeah, same way, because I'm excited about the result the same way as patient is. It's their nose and it's my surgery. So we're both in it and we both want to see the result. Obviously, they are the ones who are going through the process, but yeah.
So do you bring them back after a year?
Absolutely. We bring patients all the way to 1 year. I really emphasize on their follow-ups. I always tell them all the follow-ups are included. Well, all the expenses, with the price for rhinoplasty and everything. So there is no consultation visit at that point. And sometimes, again, if I need to do a laser touch-up or any scar module, everything is included. I really encourage people to come back. And sometimes it makes a difference because, again, sometimes patients with thicker skin or sometimes unfavorable patterns of scarring, I can intervene if I see them on time.
You mentioned scar modulators earlier. Mm-hmm. What is a scar modulator?
These are some chemicals that we use in the plastic surgery world to change patterns of scarring, sometimes thickness of the scars. And sometimes we use also lasers to improve collagen density of the scar or certain characteristics such as color and contour of the scar.
Okay, so you do a lot of noses. Is that really your subspecialty? Is facial plastic surgery, but mostly noses?
That's my niche. That's what I do the most. But again, I like other facial surgeries too. That's my favorite. I do a lot of odoplasties. I do eyelid surgery, forehead and brow lift, face and neck lift, chin augmentation.
And there's I think someone told me it's about 25,000 people live in Beverly Hills proper, and there are hundreds of plastic surgeons. So clearly you are not all operating on the people who live in Beverly Hills. And that means your patients are coming from California, but probably all over the world. Is that true?
Absolutely. My case tomorrow is from out of town. He got here for his preoperative visit today. He's going to be here in LA for about 2 weeks. We want him to stay at least 8 to 10 days.
And so does your team do anything to help those people who are traveling have a comfortable stay while they're there?
Yeah, absolutely. My patient coordinator, she's been doing this thing for a long time. We do have both nursing facilities, and we can help them actually if they want to stay in hotels and all other types of accommodations.
They should expect to stay for about 2 weeks. It's not the kind of thing that you want them to come and go quickly for.
Exactly, because at least, again, for 8 days is the minimum that I want them, because they're going to come here at least a day prior to the surgery. And then we remove the splints and casts for after 7 days, usually. And then we want to still, have them around for another 1 or 2 days.
If the weather stays like this, nobody's going to stay for 8 days. They're just going to be like, forget it. It's so bad.
Right. It's been a particular winter in LA. Yeah, it's usually.
People come to California thinking it's going to be sunny and warm, and no.
Right.
At least if you were recovering from surgery, you wouldn't feel so bad about staying.
Exactly. You're like, if I cannot have fun, let it rain.
Yeah, exactly. So we've talked about where you are now. I want to get into how you got here. So will you kind of take us through your educational path and where you did all of your training? And from the patient perspective, I think it's important for us to understand why that training was important and not necessarily just a list of schools, although I always find that interesting anyway.
Sure. So, my family is based in LA, and I did my undergrad in UCLA. Then when I applied for medical school, I actually wanted to go to San Diego as my top choice because it was a great school, and I wanted to explore somewhere that was far enough, close enough. In San Diego was perfect. So I did my medical school in San Diego. Then for my residency, I did my internship in San Francisco, and I did my residency in Pittsburgh, University of Pittsburgh Medical Center.
I was worried that you were never going to leave California there for a second.
I know. No, I was due for training on the other side of the country. It was great. Pittsburgh is a very heavy in surgical subspecialty type of training. And so I did my head and neck surgery there. And then once I finished head and neck surgery, when I decided I want to do facial plastics, I went to Penn State for my facial plastics. And then by the time that I was 5 years away from California, I was like, okay, now I know that I want to move back to California.
That's perfect. And you're never going to leave again.
Well, we'll see. You never say never. But yeah, I love California.
Highly unlikely.
Highly unlikely. Now I'm established here. My family is here. So
what do you like to do when you're not at work?
I'm into sports. So, as far as general routine fitness stuff, I love skiing. The winters, I do a lot of ski trips if I can manage. And I follow soccer, international soccer. So whether going for games or watching it, that's one passion of mine. I also like fine dining and traveling. So those are two other things that kind of like dictates what my free time.
What was the last trip that you went on?
The last trip was Mammoth. We went to Mammoth for ski 2 weeks ago.
How was the skiing?
Oh, great. This year has been, I think it's going to be a record snow. Yeah, this year, everywhere you go, it's like these walls of snow around you in Mammoth. You drive through them. Yeah.
Amazing. Okay, so let's wrap it up with probably the most important question for anybody who's listening is, what would you like patients to know about you in terms of what can they expect when they come to see you face to face?
I'm very invested and passionate about what I do. And I love what I do. So for people to come here, we all become surgeons out of passion. Nobody's going to go through that intense residency if they're not passionate about it. Our practice, the focus is on authenticity. It's a boutique practice. We like our patients to feel from the get-go that, it's something that it's a practice. They get to know us and we get to know them. And it's it's a personalized and individualized approach to this surgery. You look at our online reviews too, and you see a lot of the reviews are about not just me, it's about my staff. So they get a collective feeling of, okay, this is home. They are cared for. I always tell them, like, there's no question before surgery. I always tell them there's no question. It's a bad or stupid question. If it's really in your head, you should ask. The more informed you are about the surgery, the happier both of us will be after the surgery.
Well said. Thank you. Where can we find more information about you if we're interested in coming to see you?
Our websites, we try to make sure that our website is always updated. And then there are different platforms such as Real Self, Yelp, Google. Those are standard ones. I participate in academic meetings. There's one that's always in San Diego that I go to. California Society of Facial Plastics meetings I go to, and I do presentations there. So there are, a couple of other academic websites that they can find us information about us. And obviously social media that we just talked about, our Instagram, and then our TikTok is pretty new. We started that within the last year.
What's your website address, and will you spell your last name so we don't miss it if we're driving in the car?
Exactly. So it's Sedgh Plastic Surgery, and Sedgh is S as Sam, E as Edward, D as David, G as George, H as Henry. I have to spell that out all the time. That's why I'm good at it.
Yeah, you had those ready to go, didn't you?
Exactly.
I would be like, E is for...
Yeah. Yeah, it's a tough one.
And your Instagram is Dr.
Instagram is Dr. Sedgh. Yeah.
DrSedgh. Yes.
Yes.
Those are some beautiful noses. Thank you for sharing yourself with us today.
Oh, absolutely. Thanks for your time, Eva.
If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor, or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.